Good evening. I'm Andrea Klein-Tilford, President-elect of NAPNAP. I'm very pleased to welcome you to this evening's Team Peds Town Hall. COVID-19 emerging impacts threaten the health of the pediatric advanced practice nursing workforce. Before we get started, I would like to review a couple of ground rules to enhance our experience this evening. Please use the Q&A function rather than the chat box when submitting questions, so that we are better able to organize and respond to questions. Pre-submitted questions will be addressed prior to those that are entered into the Q&A section this evening. At the end of our hour together, we'll be asking for viewer feedback to a few discovery questions using the chat box feature. At this time, I would like to introduce you to our esteemed presenters, Dr. Jessica Peck and Dr. Jennifer Sonney. Jessica Peck is a clinical professor at Louise Harrington School of Nursing at Baylor University. She's an expert clinical and academic scholar who provides innovative, visionary, and award-winning leadership to develop and lead inclusive and diverse interprofessional teams to provide outcomes of high-quality healthcare. She currently serves as the president of NAPNAP. She has served many other organizations in various capacities and is a nationally recognized policy expert. Dr. Peck is a frequently requested national and international speaker on anti-trafficking and health prevention for children at risk. As both a nurse practitioner and a mother of 4 children, she has a special interest in educating and equipping families to promote positive physical, emotional, mental, social, and spiritual health. She is an accomplished author of clinical articles for peer-reviewed journals, a regular contributor for parenting magazines, and a frequent guest on radio, television, and other media to promote the health of children. Dr. Jennifer Sonney is an assistant professor and the Elizabeth C. Giblin Endowed Professor of Symptom Science at the University of Washington School of Nursing. As a clinician scientist, her program of research focuses on improving immediate and long-term health outcomes of children with asthma by reducing symptom burden through novel technology solutions, innovative interventions, and a cutting-edge clinical practice transformations. Dr. Sonney spent 10 years as the director of the PMP program at Washington, but recently stepped down in order to spend more time teaching. She delights in drawing upon her 15 years as a PMP to bring pediatrics alive in the classroom. Jen is deeply committed to promoting child health equity and APRN practice. In that pursuit, she has served in many leadership positions, including as an officer on the NAPNAP Executive Board. After serving for 2 years as NAPNAP Secretary, she is exceptionally honored to begin her term as President-elect in July of 2021. Thank you, Dr. Peck and Dr. Sonney, for bringing us this evening's presentation on a critical professional workforce issue.
Well, thank you so much for that introduction, and thank you all for joining us this evening. I know there are starting to be a lot of activities going on during the summer, which is exciting to see signs of life again and socialization and carefully thought out ways. And so we appreciate you joining us this evening to talk about this incredibly important topic. So several months ago, when we started to really think about how this pandemic was going to impact many facets of life, one of the biggest narratives that came out was how it's impacting nursing. And I think equal to that is how it is impacting child mental health. But we really wanted as an organization to make sure that we were supporting our members by evaluating in an objective and scientific way how this pandemic is impacting you. I think all of us can share similar stories of heartbreak, as we have had many phone calls with our friends and colleagues across the country, many of whom we usually see in person in conference or in other various venues, or even in the halls of our hospital or your clinic or our academic setting. And we've all been isolated and telling each other stories through tears of the way that that's been impacting our profession. But Jen and I really wanted to look at this from an objective way. And so we were commissioned by the executive board to survey our organization. And we're going to share some of those results with you. But to give you some background before Jen starts to go over the results, We looked at nursing. Of course, nursing is the largest health profession in the United States. There are nearly 4 million of us, and we are the largest and most trusted health profession in the United States. And we have been the face of healthcare to the American public during the pandemic. And many times, the public wants to see the care. They respect and applaud the care that we give as nurses, and we do that. And you see us with mask marks on our face, but we do a lot of other things too. We do a lot of other things than direct patient care. And we wanted to evaluate how this was impacting specifically pediatric nurses. We saw many surveys coming out just about nursing in general or other groups of nurses, but really nothing about the specific impacts on pediatrics. And we know that the COVID pandemic has impacted the pediatric profession like no other health crisis in our lifetime. We know that while physical disease impacts on children have generally not been as dire as some historic precedents, like my great-grandfather talking about being afraid of polio, children are by no means spared by COVID-19. Pandemic conditions have fundamentally altered the norms of pediatric care delivery as a profession. All of us, I think, are practicing differently. We are adapting daily, sometimes hourly, sometimes minute by minute. We do see severe COVID in children with pre-existing conditions, life-threatening multi-system inflammatory syndrome, disturbing disparities in severity of illness and death, particularly for children of color, who account for 75% of pediatric COVID-19 deaths. We're all concerned about free-falling immunization rates with no recovery yet in sight. And the list goes on, and many of you have submitted your concerns and your list even for this town hall. As a profession, I know many of you are working far more hours for far less compensation. I think all of us have been in that boat to some degree. And again, isolated from our professional networks. We're learning new technologies and implementing new policies in very little time with very little support. If you're in school-based health or primary care, you're just trying to hold on maybe and make ends meet and waiting for the kids to come back. If you're in acute care, children's hospitals have received less than 1% of all federal relief monies provided to U.S. hospitals, so many children are without access to care. And faculty, if you're faculty listening, we're exhausted and experiencing vicarious trauma, hearing the devastating stories from our students. And this is all contributing to a destabilized pediatric infrastructure, and that disproportionately impacts marginalized children. But most of all, we're talking about mental health impacts. What is going to happen to our children? What's the long-term impact? How will this shape our future? Because we know children are isolated and lonely, they're spending more time online. We are all seeing more presentations of anxiety and depression. And more importantly, I think these things, although they make our hearts hurt, we are considering our own personal mental health stressors and the impact of our ability to care for the public and these children who need us now more than ever. You are all worried about children everywhere. I know you're worried about your own children. I'm worried about my own children. I have 4 who I've had to homeschool while being a first responder in a pandemic. You're worried about putting your family members at risk by doing your job. You're worried about your own health. You are discouraged by misinformation, as we all are. And in summary, as a profession, we are exhausted. And the sustained professional and personal impacts of the pandemic are really placing us at high risk for moral distress and burnout. Heavy, it's very hard, but hope is alive and well. At the National Association of Pediatric Nurse Practitioners, we are committed to supporting a high quality, accessible, affordable care continuum for pediatric patients, but also protecting and supporting our pediatric workforce pipeline. So Jen and I looked at, in this study, our purpose was to see how can our organization, how can NAPNAP respond to our members who are in distress right now? But secondly, what lessons are to be learned to engage sustained effective response and to shape preservation of the future of our profession? So Jen is going to share some of the most significant highlights from our study that we did. Jen?
Thank you, Jessica. And thank you everyone who is tuning in live and or watching this back later on. This was a really important project and we knew that we needed to do it right. We also knew that NAPNAP needed to respond and support our pediatric APRN workforce. But in order to know how to do that best, we needed to understand how this was impacting you. So as you know, we conducted the study to understand the unique impacts of COVID-19 on our pediatric APRN workforce. And then we will hope to use these results to then drive our response. Now, nearly 900 of you responded, which is record-breaking for NAPNAP and represents over 11% of our membership. It also shows how important this issue is to all of us and that we really do need to understand it and address it. I don't think it'll come as any shock that among the most alarming findings was that 73% of you reported increased presentations of child mental or behavioral health concerns. We suspect it's the cumulative impacts of social isolation, loss of safety net services, family stressors, trauma, deferred care have all led and contributed to this surge in mental health needs. The evidence also indicates that marginalized youth are disproportionately affected, as Dr. Peck already highlighted. And we know that it'll take swift, sustained, and multi-level interventions to address this issue, and that the pediatric APRN workforce truly represents a critical access point for those services. Another key finding was the mental health needs of our own respondents, with more than a third of you reporting moderate or extreme concern over feeling professionally burned out. In addition to that, we saw 25% report anxiety and 15% report depression, with one person commenting, "I'm so lonely these days, it's hard to breathe." This very clearly shows that our pediatric APRN workforce is similarly experiencing a surge in mental health needs, with a significant portion feeling professionally burned out, which truly does pose a threat to our workforce. And finally, I want to highlight the ways in which this has fundamentally altered how we prepare that next generation of APRNs. Amidst all of the challenges with adapting to distance education, nearly 70% of our colleagues working as educators reported moderate or extreme concern with clinical training site availability. Now, we know training standards are firmly established and those are non-negotiable. So by having diminished availability of sites, that's led to delayed graduations and ultimately constrains our workforce pipeline. So when you consider these all together, these cumulative impacts have led to a surge in pediatric mental and behavioral health needs, while our APRN workforce is facing burnout and a constrained pipeline of new graduates. So this is a very serious threat to our workforce amidst unprecedented need, and really highlights where your professional organization, NAPNAP, needs to step in and respond to support you.
So listening to those statistics, really, they're very sobering, and they're just affirmation of what we've all been hearing anecdotally from our friends and from our professional networks. And they're concerning to us, alarming even, but here in this moment, we want to acknowledge that really they're heartbreaking, and we see you. We see your struggles, we feel the pain that you're experiencing, and we honor your sacrifice and service. It's been so wonderful in this year of the nurse to see how the public has loved nursing and they want to help. They are offering cheers and songs and free coffee and sidewalk chalk messages. And those things are very lovely gestures, but they're really not enough to sustain a response to the crisis that nurses are facing. COVID-19 has illuminated fissures in the United States healthcare systems and cast a spotlight on startling health inequities that we have known about as nurses for a long time. But now we see plainly how disproportionately impacted marginalized communities are and the serious threats to the existing and future healthcare workforce. Like I said earlier, while the care of nursing is loudly applauded, the voice of nursing lacks equal attention and respect. Nursing is a scientific profession of highly educated scholars. We are experts, we are leaders, we are care practitioners who are ideally positioned to provide voice and influence for pandemic preparedness and response. APRNs especially are ideally situated leaders at the epicenter of this global crisis, and we must be involved in decision-making processes seeking prompt and effective solutions. We have to assess and respond to and acknowledge the pandemic-related trauma that we all have endured as a profession. And we have to prioritize efforts for programmatic efforts to cultivate holistic wellness. And so the executive board of NAPNAP and the staff have commissioned a COVID-19 response task force to make recommendations for a sustained response to the workforce. And this is led by our resident nursing workforce expert at NAPNAP, Dr. Kristen Hiddle-Geely. And she is working with the Professional Issues Committee to create 2 position papers on the response and what we should do, recommendations for a prioritization of resources so that we can respond to our membership and make sure that you are supported both now and in the future. Those results will be announced at the fall convening of pediatric experts in October in Orlando if you are able to join us. And we will also be sharing those by virtual means at a date to be decided. So we are really excited about the work to come that has already begun, and those work groups are working fast and furious to get those recommendations to us. But most importantly, we want to acknowledge the need for a sustained response. A recently published systematic review of the impacts of COVID on the health workforce warned of the imperative for governmental leaders, policymakers, health organizations, and professional nursing organizations like ours to take actionable steps quickly to support nurses. And this quote was in the article and it really stood out to me. I highlighted it and I've read it several times, and it said, without this, nurses are likely to experience substantial psychological issues that can lead to burnout and loss from the nursing workforce. So as experts in pediatrics and advocates for children, we need a seat at leadership tables to guide a systemic, sustained, and effective response to the crisis facing nurses. Nursing is a resilient, innovative, tenaciously hopeful, and life-giving profession, and I am confident of this, that we will come through this stronger together. And so with that, I'm going to give it back over to our moderator, and we're going to take some of your questions.
Great. Thank you, Jessica and Jennifer, for sharing this amazing work, which is both illuminating and alarming. These results will impact our profession for years to come. At this time, I would like to ask Jessica and Jennifer to join together in responding to questions that were pre-submitted by our audience. First question for you: how can I stay consistent and caring when it doesn't seem to matter to patients and to other healthcare providers?
Well, you didn't unmute, so I'll go first. I just want to first say that I'm so sorry to whomever is feeling that way, feeling undervalued and underappreciated. And I have a few thoughts on this. The word unprecedented has been overused in the past year. And so instead, let's call this an exceptional year or year and a half. And the uncertainty, the fear, the collective loss that we all are feeling it's shared across the global community. And we can see from our own study, as well as countless others, that the cumulative stress and trauma from this are manifesting in mental and behavioral health impacts in our patients, our families, and ourselves. And we also know that we all cope differently. And I suspect that patients and families who outwardly may appear indifferent, they just may not have the capacity left for that appreciation and compassion that maybe we're accustomed to. But it still hurts and it's still demoralizing. And if this is happening repeatedly, I certainly can understand feeling dejected about this. I think it might be helpful to remember what we know. And the evidence is there and clearly shows that patients and families do appreciate our work. We know that our integration of best practices and care tailored to their specific needs and priorities is effective, it's necessary, and it's critical to promoting child health equity. We also know that what we do matters as we establish a child's lifelong health trajectory. So perhaps consider this. Number one, be sure you're taking care of yourself and your needs. We've clearly heard that you all are exhausted. Burnout is very real and it's threatening our profession and your livelihood. So we must prioritize our own health and wellness in order to care for others. I think we could all use a reminder to establish and maintain boundaries. And many of our traditional boundaries were obliterated in this past year and a half. But such things as truly being off on a day off and finding ways to disengage from stressors wherever possible seems really important right now. And of course, finding loved ones who will support you in your needs. And finally, I I want to say that we should seek help when needed. This could be a mental health professional to help cope with stress, trauma, anxiety, depression. It could mean convening your colleagues to debrief and establish a team-based approach to establishing your new normal, or at least a discussion on what it'll take to shift from merely surviving to thriving. So I don't have all the answers and I wish I did, but at minimum, we need to remember to take care of ourselves. And as nurses, we aren't always very good at that. And I think when we are healthy, we're best able to care for others. So I offer those suggestions and certainly welcome others from Jessica.
Well, I think that was beautifully stated, because I think we can all agree as nurses, we are so excellent at providing care for others, and sometimes just the worst for providing care for ourselves and stopping to do that. And especially in this time of need, I'm sure we've all had similar experiences where there's just been such great need around us. Our families are calling us for our opinions, our neighbors, patients who we're constantly having to reassure. And so the demands on our time and the demands on our emotional and mental stressors are greater. Another suggestion I would have would be to go back and listen to the recording of the town hall that we did earlier this year with Dr. Bernadette Melnick. It was really excellent, and she provided a lot of tips that she, in her words, she said they are simple, but they are not easy. And I thought, yes, that exactly characterizes the things that we need to do to care for our own mental health. She talked a lot about gratitude and how the intentional practice of gratitude can really make a difference in our mental health. And again, something that is simple, but is not easy. She also has a Cope to Thrive program. It's Cope, the number 2, and Thrive, a program for cognitive behavioral therapy that is good for nurses. It's good for students. It's good for anyone who is experiencing anxiety and depression. And I would echo what Jen said about wanting to reach out for help when we need it. I think all of those things are good. And know that we are here for you as a professional organization. In this time of isolation, all of those normal support networks that we have had have been taken away. And so if you are able to join us in October, we would love that, whether it's the in-person offering or the virtual offering that will come soon after that. We would love to hear about your experiences, and we're being very intentional in designing that experience to speak to your emotional, mental, professional, and physical well-being. We're being very intentional and thoughtful about that. And if you go and look at the agenda for what we have planned, I think you'll see that thoughtfulness and mindfulness there to have that time of renewal where we can reconnect and rediscover.
Great. Thank you, Jessica and Jen. And as a reminder, please submit your questions as the chat. And at this time, we'll move on to our second question that was pre-submitted by our audience. How do you recommend discussing compensation or salary negotiation after being furloughed and then rehired when you're just happy to have a job?
I'll go ahead and take this one first, Jen. This is a very difficult thing to know our value. And I'm going to give you some advice that Kristen Hiddle-Geely actually sent to us before. She's working in the pediatric ICU tonight and could not join us. But she talked about how nurse practitioners who are hired by physician groups in a hospital setting who have advanced practice infrastructure are more likely to have support. And are they going to have that professional network that you can do? And so I think in those kinds of circumstances, it can be easier to band together and to meet with your colleagues and to really have discussions about how to help each other and to strengthen each other's negotiating power. But if you're by yourself, that can be a very difficult thing to do. And I have been in that situation at a small community regional hospital where I'm the only nurse practitioner. And a lot of times you're seen as expendable and they want to decrease your compensation while still increasing the workload that you do. And so my advice would just be to know your market value, to know the value of your work. And this goes a little bit into the next question, but a lot of times they may ask you to do nursing work, but just hold your ground and offer them the other skills that nurse practitioners have, We are skilled at much more than bedside nursing or direct patient care, although that's an important part of our role. But we can also do a lot on policy revision and analysis, or quality improvement initiatives, or evidence-based practice projects, or leadership roles that are needed to improve processes or systems that maybe have been altered and disrupted during COVID. So I would just hold to your value, because I guarantee you that physicians would do the same. And so we need to know what our value is, and want that compensation that's equal pay, that's fair pay for the work that we're doing.
I agree with everything that Jessica said, and I have a few more perhaps pragmatic tips. For those of you that know me, I tend to be a rubber meets the road kind of gal. So what are some things we should actually say or consider in perhaps an interview or in that follow-up when an offer is made? And I think one of the best pieces of advice I ever had, and I've certainly relayed this on to many of my graduates, is to really address the elephant in the room and to call out, first of all, there is a pandemic, and obviously that has fundamentally altered healthcare, but to ask them specifically, how are compensation decisions made at your agency, your clinic, your hospital? You're grateful for this opportunity, but you want to understand how they make those decisions and what their expectations are for the role. So what sort of performance evaluation approach do they take? How will you be reviewed on an annual or semi-annual basis? How are those compensation decisions made? Are they using a market analysis, or is it norms within the institution? How do they approach cost of living or other salary increases? Because it could be that your salary is lower than what you had hoped for, but is there opportunity to renegotiate that at a later date? Understanding all of those processes is really important. Is there consideration of productivity, and how might that be considered? And what are the norms among other NPs in this setting? And trying to understand in that way. So I think my advice is to use appreciative inquiry to understand and somewhat turn the tables on them to understand what is their philosophy when it comes to compensating NPs, and certainly what sort of structure they use for reviewing and administering raises.
I agree with that. And the other really valuable tool is to know how much money you're bringing in to the practice, to know how reimbursement is given from the insurance that you're bringing into the practice. That is a really important thing to do. And there are lots of resources. If you think, oh my goodness, I wouldn't know how to do that. And some places it can be difficult, because if you have incident to billing, or if you're not billed under your own provider identification number, that can be difficult. But I would encourage you, if you don't know how much revenue you're making for the practice, to find resources. There are lots of experts around the country, and webinars and continuing education and other resources where you can find out how much money you're making. And then the last piece of advice that I would give is, when you go in to negotiate, to be confident. As nurses, we are notorious for underselling ourselves and for taking an apologetic approach. But knowing on paper the value that you bring, and if you could even write that out to say, these are the things that I bring, this is the value that I bring to the team. Another example I can give you from my own experience and practice is that when I joined my community regional hospital group, the patient satisfaction rates were very low, because the physicians were overworked, for one thing. And for another thing, they were there during the day and they would leave early in the afternoon. And then it would be till the next morning that someone would come in. Well, I came in the evening or the afternoon and would see all of the nighttime admissions. And so patient satisfaction rates went up. Well, that translates to economic benefit, because of course, we are scored on Press-Ganey scores and things like that. And just doing a little bit of research and saying, this is the value that I'm bringing, those can be helpful. And so just go in there with a confident assertiveness, just knowing that this is what you have. And sometimes it's easy for us to be intimidated and say, oh, okay, well, that's fine. But knowing what you're going to have and consulting with somebody and practicing before, those can all be helpful things too.
Great, thank you both. So taking a sneak peek at the Q&A, our next question that we have that was pre-submitted is a little bit similar. So the next question is, how do NPs protect their role, specifically avoiding nursing tasks during low census? And a little bit of this was already weaved into your prior answer, but Jessica and Jen, do you have any other tips for our audience today?
Yes. So as I said before, Dr. Kristen Hindle-Geely is our resident workforce expert, and she said, she sent us this note and said that as far as the pre-submitted questions, the only one I have strong feelings about is this one. And she does work in an ICU setting. And she said, I'm going to share with you what she said. She said, it's important to ask and understand when looking for NP jobs who hires you and who you report to. So nurse practitioners, like I said before, who are hired by physician groups in hospitals or those who work in hospitals with an advanced practice infrastructure are much less likely to be asked to assume nursing roles compared to NPs who report to a unit nursing manager. So her advice is to consider proposals that allow you to use that low census time to do projects in your practice area to advance the quality of care. That may be education with staff, or developing and implementing a QI project, or organizing family group education classes to show how you bring value to the practice as an NP, even if the opportunity to provide direct patient care is temporarily limited. Because as I have said, and as Jen has said, nurse practitioners are great at and capable of more than just patient care. And the honest bottom line truth is that everything in healthcare, especially now for children's hospitals in particular, and for pediatric practices, that we have experienced significant financial distress. We have fewer children who are accessing care, and that means less revenue. And so if you can think of ways to make an impact, but that also will improve revenue, then that can also be helpful in making your proposal. So for example, I have a DNP student currently who's working on an HPV vaccination campaign. She's trying to bring in children for the HPV vaccination. One of the important pieces of her proposal, though, was how much revenue that would make. Now, of course, we're not doing that to make money, but at the same time, if it's going to have that collateral benefit that is there, then that's something that's important to point out, just to get buy-in from everybody who's on your interprofessional team. They're much more likely to support you if they know it's not going to cost the organization more resources, and it's going to optimize patient health and improve the bottom line. And so this would be my last shameless plug for any of you out there who maybe are master's prepared and have been thinking about getting a Doctor of Nursing practice degree. This would be a great time to do it, because we see the DNP degree really equipping and preparing APRNs across the country to do projects just like this. And you can have the tools and resources to do that. So I would just put in, like I said, a shameless plug to consider jumping in the deep end of that pool. Jen, I'm sure you have things to add.
I honestly don't have a lot to add to that. I do think that anytime we have a major event, whether it's a recession or now a pandemic, a lot of people do a lot of reflection in their careers and reprioritize perhaps. And we do see often a surge in those pursuing education. So that certainly seems reasonable. If any of you are thinking about it, you also have PhD prepared panelists here, myself included, and would be happy to speak to that as well. But perhaps you're interested in generating new knowledge and pursuing more of a scientific degree. Nonetheless, I agree with everything that's been said, and that this is exceptionally difficult. I see a number of questions in the chat pertaining to the same issue, and I'm not sure that I have more to contribute other than to say, understanding your structure, reporting structures, as well as your job duties is going to be really critical to know if you even can be asked to pursue RN work. And if you cannot, then again, pointing out ways in which you add to the value is a pretty wise approach.
And I see in the chat someone asking about holding your ground being essential, but finding yourself doing far below what you are trained to do. The example given here is scribing and writing clinical notes, and how can you maintain your sense of professional self-worth and stay employed? Sometimes those two are mutually exclusive. Sometimes those two are not possible together. Sometimes it just depends on where you're at in your life. If you are the sole provider for your family, if your family is dependent on your income, you may find yourself in a job where there is dissatisfaction. And so I would encourage you, I've always taken the mantra of I want to be happy where I work and support the leadership and believe in the mission and vision. And if I find myself not in that place, then I'm going to try my best to have the courage to leave. Sometimes that's taken me, a series of months. Sometimes it's taken me more than a year to move to where I feel like is the right fit for me at the right time. So if you have the luxury of, being able to quit that job and find another job, then that is really good. Otherwise, I think just using all of the professional supports that we've talked about earlier in question 1 is going to be essential. Building your professional network is so important. And the ways that you're going to find a job are by engaging with us as an organization, because we have career resources for you, and just networking. I cannot tell you how many, even today, I had an opportunity for a consulting opportunity for 2 of my colleagues that just came from networking, and I knew their worth. And so I called them. And actually one of them is on this call, I'll just go ahead and say, but knowing that expertise, and then even, hiring faculty at my university, I'm looking to reach out to my network to see who do I know who's gifted, who is skilled in this area, who's looking. And so the more professional networking that you can do, then the better that's going to be to give you the best opportunity that's the most professionally satisfying.
Terrific. Well, that brings us to our next pre-submitted question. What are some factors cited by survey respondents that lead to burnout in the APRN workforce?
Well, we had a lot of data to contend with, and I just want to share with those attendees that we have over 1,300 open response comments, in addition to voluminous amounts of quantitative data. So the article that came out was primarily our quantitative findings, and presently Jessica, Andrea, and I are all working our way through the qualitative findings. And quite honestly, I'm the holdup right now. All that to say, there was a lot of feedback as to what was leading to burnout. And my unofficial read is that it's sort of a cumulative impact of many of these factors, and I'll share a few with them now. Over half of our respondents said that they had moderate or extreme concern with responding to disinformation. I think we all expected the long work hours, reduced pay, all of those things, but the responding to disinformation really jumped out at us. And based upon our review of open comments, this appears not just within a work environment, but even during that precious downtime. The pressure from being a trusted resource for friends, for family, as well as thinking about all of our social media outlets. It just seemed as though there was this constant barrage to be an informed health professional, and truly it was just unrelenting. We heard a lot about constant uncertainty and evolving information policies and procedures. It felt like things were constantly changing. And so, in a work setting, this meant lack of policy or rapidly evolving policies, rapid adoption of new technologies or standards that were unfamiliar, all amidst PPE shortages and perceived lack of support. Another large portion of responses related, of course, to jobs, job loss, job scarcity. We heard from a number of new graduates reporting inability to secure new jobs amidst all of that uncertainty. We saw people experiencing cut hours, furloughs, layoffs. Primary care practices, we know, suffered, and many experienced closures and staff reductions, while inpatient and hospital systems had drastically reduced services to those just deemed essential. I think another important call out is safety. We expected to hear concerns for personal safety, and we certainly did. We saw about 20 to 25% of respondents report concerns for their own personal safety, especially early in the pandemic. But what was surprising, or perhaps not so, if you think about it, was the bigger concern was for friends and family, with 35% reporting moderate or extreme concern. They were worried that they were putting their friends and family at risk. including those with pre-existing conditions. We had many members report concern about how this would impact them during a pregnancy. Many members that separated themselves from their family in order to mitigate that risk. And that's just further compounding feelings of isolation and other mental health impacts. Finally, of course, we've heard this on the news, and it certainly was prevalent here as well, is that we had a large portion of responses related to the stress of working while maintaining caregiving responsibilities. I certainly experienced that myself, and I'm sure many of you as well. So even among those that were able to perhaps transition to telehealth or remote teaching, you're still struggling to support educational needs of children or care for others that depend on you. And it was just a lot. So again, I don't think it's any one specific issue, but rather that cumulative impact over such a long time and all of that uncertainty of when will this end. So I expect additional findings to come out once we do our qualitative analyses, but for those of you that have ever tackled that, that's a very big task in normal times. And when you have 1,300 comments to sift through, it's just going to take us time to do it right.
I would agree with that. I mean, obviously, you all have a lot to say about that. And we felt that, we really felt that. And so we just can't say again enough how important it is we are seeing to be able to connect with your colleagues, to be able to pick up the phone and talk to someone, or to join groups like this, or to be together with people who have had similar experiences, to be able to debrief. And we are planning some debriefing for October, because since this started, we have been in crisis mode, really, and giving the country literal CPR. And we have not had any time at all for debriefing. That's only just now starting, because even now, as the country's starting to change, to turn a corner, we are all involved in vaccination efforts, especially now that there are approvals for ages 12 and up. And so as we turn around to the fall, I fully anticipate that moment is going to come for us collectively as a profession, where you've experienced trauma, you're in the fight or flight mode. And then when we have some actual time, when things start to get back to normal, it's going to hit us as a profession, and we're going to have to process what we all have endured so that it won't happen again. And I think now is the time for nursing to rise up with a collective voice and to really use our voice as experts and the largest healthcare force in the United States. So I would encourage all of you to be an advocate for our profession in your organization, to step out of your comfort zone, to ask for representation in places where you haven't had representation before, to advocate for policies that are going to protect your workforce, to speak up when you're asked to do something that makes you feel unsafe or unsure. I think that we need to use our voice collectively now or never.
Terrific. Thank you both. Now for our last of the pre-submitted questions. And let me remind you, I see a couple questions and in the Q&A in the chat, but please continue to add. So our last pre-submitted question: what can we as PMPs do at the national level to make independent practice a possibility for us all?
I'm going to jump at this one. This is something I feel particularly passionate about, being a Texan and being in one of the most restricted nurse practitioner states. Unfortunately, there is not a lot that we can do at the federal level about full practice authority. We have a patchwork of state laws and state boards of nursing that govern nursing practice. The biggest accomplishment we had at the federal level was led by Dr. Penny K. Jensen, who was with the American Association of Nurse Practitioners and was with the VA, who accomplished full practice authority for the VA. But even digging into that, there are caveats to that, and it is not a blanket authority. There still are processes in place to have that, but it was a very significant step to be applauded. So the answer is we need your voice at the state level. You need to be a part of your state organization. You need to be a part of your policy efforts in your local NAPNAP chapter. And we do a great job of keeping them up to date. We just had our policy call on Monday where we reviewed some state policy issues. but we really need your voice at the state level to talk to your legislators. All politics is local. And so you need to get to know your local legislator. They want to know your experience during COVID. So if you have never done that before and that scares you to death, it's not that scary. People want to hear from nurses, and generally, even legislators and politicians are nice to nurses when they come and visit. And so go and just share your experience with them. Call and ask for an appointment and just share your experience about COVID. Just say, this is how COVID impacted me. And they want to hear your stories. If you're a nurse practitioner, the other success that we have had here in Texas is inviting them to come to our practice, because what they perceive as supervised practice is not the case if you're in a restricted state. And they come to your practice and they see you there by yourself seeing patients. They think, wait, where's the supervision? And you say, oh, it's right here on this paper. That's where the supervision is. And so I would really encourage you to get involved, again, with your state association, with your policy chair for your NAPNAP chapter, because your story is the most powerful thing and is the most important. And all across the country, we've had some really exciting things. Massachusetts just had full practice authority, and some of our NAPNAP members were at the forefront of that. And also in Minnesota, our own Dr. Mary Chesney, she's written about it in the Journal of Pediatric Healthcare. So you can read about that. So I would encourage you just to get involved.
There's really not much I can add on top of Jessica Peck, who is a force of nature when it comes to health policy. But what I will say is that I want to call out that it is intimidating to get started. And if you aren't quite sure where to begin, I just want to highlight some of what Jessica said. Number one, join a professional organization. Your professional organization is working on your behalf. So your membership helps support those efforts across all of the states. Joining your local chapter will really help focus and support their efforts to that extent, and supporting NP practice. Now, I happen to work in an independent practice state, and it's lovely, but I too have had legislators come visit me in clinic, and it's great for them to be apprised of what NPs are, what we do, and the families that we care for. So at minimum, by joining, and if you feel like you have some bandwidth, you certainly don't have to run for office, though we certainly would welcome that. But there are micro-voluntary opportunities, and I'm shamelessly stealing that term from Michelle Stickle, but there are opportunities to have circumscribed time to spend on a certain issue that maybe you care deeply about. Your legislative chairs in your chapter is going to help you identify those. There are certainly opportunities from the national perspective. You can sign up for Inside the Beltway and some of the other blast emails to keep apprised of what's happening. So I would just advise, don't be intimidated. And the best way to get involved is to take a first step. And you never know. And just ask some people that are doing the work how you can support that. That's my advice for getting started.
Perfect. Thank you both. So let's take a look here and see if there's anything we haven't addressed in the Q&A. One thing that I'm seeing here, Jessica and Jen, that you might be able to help with, what is a typical starting salary for a new PNP? And does this vary drastically between inpatient and outpatient settings? And how much does geographic region play in that?
So it's going to be highly variable depending on the area. So geographic, where you work, whether it's rural, urban, suburban, is going to matter. The setting is going to matter, the role, and of course your experience level. So I know that's probably not the answer that you want, but I'm not going to be able to give you a number because it's highly variable. But there are resources available. I think Melnick has one that's free. But I know for certain salary.com is, and you can plug in pediatric nurse practitioner as well as the zip code for the area in which you want to work. And they will give you a bell curve of the typical salaries from the 5th percentile all the way up to the 95th. And so what I would advise many of my new graduates was to at least have that in mind so they have a sense of the range in which they might begin. But a new grad usually isn't at the 50th percentile. They're usually earlier on that curve. So those are a couple of quick suggestions that I have for having a sense of what even is the ballpark to expect.
Another resource I would give is that many state employees, so if you're employed by a state health organization, that is publicly available data. So if you're interviewing for a state institution, you can look and just do a quick internet search to see if you can find that database to see kind of what is the ballpark. And the other awkward thing is always, there will be differing opinions, but I always advise to let them make the first offer to see, because you never want to lowball yourself. And so a question that I advise my students to ask is, or a statement that I advise them to say is, I'd be happy to entertain a reasonable offer for someone with my equivalent education and experience. I'd be happy to entertain that. And then see what they send you. If it makes you fall off your chair, well, then great. If it makes you fall off your chair in a bad way, then you can use those resources to help to negotiate a better offer. Many times, when you're as a new nurse practitioner, many times you're going to be paving your own path and creating your own path. And you may be in a place where they haven't had a nurse practitioner before. And so that means there's always room for negotiation in that. As sometimes in the more prescribed structures, they know exactly what the market value is and they know what they're going to offer you. But sometimes when there's more ambiguity, there's more opportunity